right, so today I will be giving us a brief epidemiological overview of HIV in Fulton County and presenting to us a roadmap of sorts, just basically telling us where we are right now, where we want to go, and how we plan to chart a course between those 2 points. All right, let's delve right into it. So Fulton County, as we all know, is one of the top 3 counties in Georgia with the highest burden of HIV. In 2016, the CDC surveillance report ranked the Atlanta, Sandy Springs, Russell Metropolitan Statistical Area as the 4th MSA in the United States and Puerto Rico with the highest rate of new HIV diagnoses. A look at the actual numbers showed that in 2016, we diagnosed about 654 new HIV cases in Fulton County. And to put that number in some perspective, the whole state of Georgia had about 2,600 new HIV cases. And although Fulton just contributes about 10% of Georgia population, we contributed an interesting 25% of all the new HIV cases in Georgia. Looking at the trend over time, you see right there that our numbers have pretty much remained stable over time. We have, on average, diagnosed between 650 to 850 new HIV cases every year since 2010. And as you can see right there, the 2017 preliminary data shows that we still have similar numbers as at last year. And you will ask, who is most affected? As in most other jurisdictions of the United States, HIV in Fulton tends to disproportionately affect specific groups of persons. As you can see right there, in 2016, over 80% of all the new HIV cases occurred in men, and about 73% of all the new HIV cases occurred in persons who were younger than 40 years of age. This right here is a map of Georgia, Fulton County, And as you can see, majority of our new cases occur in the central part of the county, which roughly corresponds to the part of Fulton that is Atlanta metropolis. And so I've shown you in this past few slides 2 basic things. One is that HIV remains a real public health issue in Fulton County. And 2, it is a problem that majorly affects specific groups of people. When we superimpose the rate of diagnosis, which is all the diagnoses adjusted for the fluctuations in the underlying population, we will see that Fulton has also had some slow but definite decrease in the rate of new HIV diagnoses, at least as you can see over the past 8 years. We've moved from about 83 new HIV diagnoses per 100,000 persons to about 64, 65 new HIV cases per 100,000 persons in the past couple of years. However, you can see that our rates are still really high when you compare it to other places like Georgia right there. And so the 2 questions we want to talk about, I want to focus on are these. First, where do we want to go? Given where we are right now as Fulton County, where do we want to go in the next 5 years? And secondly, what can we possibly change right now? What metrics can we influence at this point in order to ensure that we get there by 2023? And that brings me to the HIV prevention targets as described by the leading global and national public health agencies. On the global scene, you have the Joint United Nations Program on HIV/AIDS. And for us here in Fulton County and the rest of the United States, we have the National HIV/AIDS Strategy as implemented in 2010 and updated in 2015. And you can see right there the indicators, actually, as they are called, and all these indicators affect different aspects of HIV care and HIV prevention. With the exception of the top one and the bottom one, the 5 middle indicators there all have to do with care of persons who are currently living with HIV. And the reason is that viral suppression in persons currently living with HIV is the key in reducing new HIV infections in any area. If you look at the terms, that I've placed right there at the bottom, these are all the care points when people talk about the HIV continuum of care. So I'm just going to briefly walk us through this. So meet Kyle. Kyle right there is a 26-year-old African-American male who acquired HIV, let's say on a cool February evening after sexual contact with a guy. Now, Kyle is infected, but he will not know it. The healthcare system will not know it if Kyle is not diagnosed. Now, on the diagnosis, we're talking about all the people who get tested, and that's when you discover that they have HIV. After diagnosis, we expect that Kyle will be linked to care, which just basically means that Kyle gets to sit in front of a well-trained clinician who will examine him, run some labs, and then prescribe some antiretroviral agents for Kyle's treatment. After that, Kyle will be said to be engaged in care when Kyle makes at least one other visit after that linkage to care, that is 3 months away from that linkage to care. And Kyle will be said to be retained in care when Kyle makes at least 2 visits that are 3 months apart after his linkage to care visit. The end goal of everything is viral suppression, like I pointed out to you in the previous slide. And Kyle will be said to be virally suppressed when Kyle has undetectable viral loads or less than 200 viral copies per mil, according to the CDC definition. The whole goal of everything is to get Kyle and every person who is infected with HIV through all these steps in order to get to viral suppression. It's been estimated that about 16.6% of persons who are infected with HIV in Georgia State do not know their status. 77% of them were linked to care in 30 days, which is the NHAS recommended goal. And then only 60% of them were virally suppressed within 12 months of diagnosis. When you look at the continuum of care for the prevalent cases, and prevalent HIV just simply means all the persons who are living with HIV in any area, irrespective of the time they were diagnosed. For Fulton County in 2016, that was about 16,600 persons. And you can see that only 49% of that 16,600 persons were virally suppressed at the end of that year. A look at the trend in viral suppression in Fulton County over time. There's been an increase in viral suppression amongst persons who are newly diagnosed with HIV. But as you can see in the red line right there, that viral suppression is higher and so much better when people are retained in care. That brings us to PrEP. PrEP, as we all know, is the use of one or a combination of the 2 currently approved antiretroviral agents for this purpose in a once daily pill to prevent HIV acquisition in persons who are at risk of HIV infection. Data that was released sometime this year, around March this year, by AIDSview and Gilead Sciences, the makers of Truvada, showed that only about 30% of all the 77,000 active PrEP users in the United States as at 2016 were residing in these southern states, despite the fact that the South accounted for 52% of all the HIV cases all the new HIV diagnoses in 2016 in the United States. For Fulton County, the same data show that there has been an increase, a strong increase actually, about over 800% increase from the number of active PrEP users in 2012 to 2016. So we turn to 2 major Fulton County, Atlanta-specific PrEP coverage studies that looked at PrEP coverage among MSM in this region. The first one is the CDC's National HIV Behavioral Survey, the MSM cycle that was completed in 2017. And our own Fulton County PrEP Awareness and Use Survey that we implemented and completed in 2018. Both studies showed that awareness of PrEP is high among the PrEP eligible MSM. And for our study, awareness was just simply, have you heard about PrEP prior to now? And 9 out of 10 of them said yes, they had heard about PrEP. But if you look there, you see that only about a third of that had ever used PrEP. Ever means anytime, ever used PrEP. And about 20%, both in Atlanta and Fulton, said that they were currently using PrEP. Racially, you will see right there that there is still some disparity between the white and the black MSM when it comes to active PrEP use. We had a higher proportion of white MSM were actively using PrEP when you compare to the black MSM, and a higher proportion of PrEP eligible MSM were in the 30 to 39-year-old demographic compared to the other age groups that were explored. And that brings us to this our report card of sorts. And you can see right there in red where Fulton County stands with each and of those NHAS indicators. We have not hit any one of them yet, but Looking at that first one, which is the actual aim of everything, we are still a ways short of achieving that goal of decreasing the number of new HIV cases by 25%. And if that is our overarching goal, our question is this: by how much can we increase, or what do we aim for with these two indicators, the viral suppression and PrEP use, have been shown to actually impact HIV incidence in any area? By how much can we increase them in order to hit that target or speed up our rate of HIV decline here in Fulton County? Now, we are still working on our own Fulton County specific numbers, but a very closely related study by the HIV Prevention Trials Network that was just presented last month did a mathematical modeling on how to decrease new HIV infections among Atlanta MSM by 50% in 5 years. And the study showed that there has to be concurrent increase both in the proportion of persons living with HIV who are virally suppressed and the proportion of eligible persons, HIV negative eligible persons who should be on PrEP. And so we propose that for Fulton County, in order to achieve a similar decrease in Fulton by 2023, we will need to aim for having a 60% increase in the proportion of persons, all persons living with HIV. If you cast your mind back a few slides before, that was about we're currently at about 49%. We need to get to somewhere close to at least 63% in the next 5 years. And amongst our active PrEP coverage, move from 21% where we had for Fulton County to about 45% of active PrEP use. Now we know that these two targets cannot stand alone on their own. There are other things that need to be done, things that need to be improved and enhanced in order to achieve this target, particularly for PrEP. We have education, because in our study, a lot of people, even though they said, I'm aware of PrEP, education, the thing that is what will make you take PrEP is that I need to know more about PrEP. So education is a very strong tool that needs to be utilized in order to increase PrEP use in Fulton County. Active leakage of high-risk HIV negatives are PrEP screening, which is where our CBOs and other facilities that do conduct HIV screening need to can get in on this. And then involvement of the private healthcare providers in PrEP promotion. This journey definitely cannot be made in one day. But as my people will say, the journey of 1,000 miles always begins with one step, our next collective step. Thank you.